Did you know that many people live with artery blockages without even realizing it? This dangerous condition can develop silently over the years and only manifests when it's too late. The result? An increased risk of heart attacks, strokes, and other serious complications that could have been prevented. In this video, our goal is to help you identify the early signs of arterial blockages. These signs are like small alerts your body sends, warning that something isn't right. By recognizing them, you can act quickly, seek medical help, and prevent bigger problems in the future. After all, early detection is one of the keys to protecting your cardiovascular health. Here, you will learn about the main symptoms that indicate clogged arteries, how to differentiate common signs from other health issues, and most importantly, what to do if you notice these symptoms. Statistics show that cardiovascular diseases are the leading cause of death worldwide, but what few know is that many of these cases can be prevented. Knowledge is your best defense, and today, we'll share everything you need to know to take care of your heart and well-being. Stay with me until the end of this video. In addition to understanding the warning signs, you'll also receive practical tips to protect your arteries and improve your health in a simple and effective way. Artery blockages, scientifically known as atherosclerosis, is a condition where plaques made up of fat, cholesterol, calcium, and other substances accumulate on the walls of the arteries. This progressive buildup causes the blood vessel, responsible for delivering oxygen and nutrients throughout the body, to become narrower and harder. Over time, this can impair blood flow and significantly increase the risk of serious complications such as heart attacks, strokes, and heart failure. But what makes this condition so dangerous? The main problem is that it often develops silently, with no noticeable symptoms in the early stages. Many people don't know they have partially blocked arteries until they face a serious cardiovascular event. That's why understanding what artery blockages are and how they affect the body is essential for early detection. Another important point to highlight is that atherosclerosis doesn't only affect the heart. When the arteries supplying the brain, legs, or other organs are compromised, conditions like stroke, peripheral artery disease, and even kidney failure can occur. Studies show that atherosclerosis is responsible for 1 in 3 global deaths related to cardiovascular diseases. Additionally, factors like poor diet, lack of exercise, smoking, family history, and conditions such as diabetes and high blood pressure significantly contribute to the development of this disease. The good news is that, even though it's a serious condition, atherosclerosis can be prevented or managed if detected early. Throughout this video, you'll learn to recognize the warning signs your body gives and take steps to protect your arteries and your overall health. Now that you understand what artery blockages are and why they're so dangerous, it's time to identify the warning sign. These manifestations can range from subtle to intense, but in all cases, they represent a distress signal from the body. Let's break them down into 3 categories to make it easier to understand: common physical signs, less obvious signs, and visible signs. First, let's talk about common physical signs. The most frequently associated symptoms with blocked arteries include chest pain or pressure, angina. This pain usually occurs during physical exertion or moments of stress and disappears with rest. It's described as a tight, burning, or heavy sensation in the chest. Extreme fatigue. When the arteries are partially blocked, the heart has to work harder to pump blood, resulting in excessive tiredness even during light activities. Shortness of breath. Difficulty breathing, especially after exercise or daily tasks, can indicate that blood flow to the lungs is compromised. These symptoms may be signs that the coronary arteries are affected, requiring immediate medical attention. Next, we have the less obvious signs. In addition to the more well-known signs, there are less evident symptoms that can go unnoticed. Numbness or tingling. When the arteries supplying the arms or legs are blocked, it's common to feel numbness, tingling, or even weakness in the limbs, pain in unexpected areas. Some people report pain in the back, jaw, or even shoulder. These pains, especially if they are frequent and without an obvious cause, can be reflections of problems with the heart's arteries. Erectile dysfunction. In men, difficulty maintaining an erection can be one of the first signs of atherosclerosis, as the blockage compromises the blood flow needed for this function. These symptoms may be confused with other conditions, but they should never be ignored, especially if they persist or are combined with other signs. Finally, let's talk about visible signs. In some cases, artery blockages manifest through visible changes in the body, pale or bluish skin. When circulation is insufficient, the skin may have a bluish tint, cyanosis, especially in the extremities, such as hands and feet. Wounds that take a long time to heal. Wounds on the feet or legs that don't heal well can be a result of poor circulation, a clear sign of peripheral artery disease. Additionally, swelling or pain in the legs after long periods of rest can be signs of deep vein thrombosis, a condition often associated with atherosclerosis. A concerning feature of atherosclerosis is that, in many cases, it can be completely silent until it reaches an advanced stage. That's why it's crucial to pay attention to the smallest signs of abnormality, especially if you have risk factors such as a family history of heart disease, diabetes, or high blood pressure. If you notice any of these signs, especially when combined or persistent, seek medical attention immediately. Don't wait for the symptoms to go away on their own, as this can worsen the situation. Detecting artery blockages early is crucial to avoid serious complications. If you've identified any of the warning signs mentioned earlier, the next step is to seek medical help. It's important to remember that only a healthcare professional can confirm whether the symptoms are related to artery blockages or another health condition. The first step is to schedule an appointment with a doctor, preferably a cardiologist. During the consultation, the professional will assess your health history. The doctor will investigate factors such as family history of cardiovascular diseases, lifestyle habits, and the presence of conditions like diabetes, high blood pressure, or high cholesterol. Perform a physical examination. This may include listening to the heart, measuring blood pressure, and evaluating circulation in the arms and legs. If artery blockages are suspected, the doctor may order additional tests, such as blood tests. These measure cholesterol, triglyceride, and glucose level, which are important indicators of cardiovascular risk. Electrocardiogram, ECG. This records the heart's electrical activity, identifying abnormalities that may indicate inadequate blood flow. Stress tests. These assess the heart's performance during physical activities or simulated exertion. Angiography, an imaging test that uses contrast to visualize blockages in the arteries. It is considered one of the most accurate methods to identify blockages. Doppler ultrasound, used to evaluate blood flow in peripheral arteries, identifying areas of restriction. These tests allow the doctor to determine the severity of blockages and develop a personalized treatment plan. If you're waiting for test results or a consultation with a specialist, there are steps you can take to minimize risks. Avoid intense physical exertion. Until the diagnosis is clear, it's important to avoid activities that could overload the heart. Adopt a balanced diet. Reduce the consumption of foods high in saturated fats, salt, and sugar, prioritizing healthy options like fruits, vegetables, and whole grains. Quit smoking. Smoking worsens arterial blockage, increasing the risk of complication. Manage stress. Practices like meditation or deep breathing can help reduce blood pressure and protect the cardiovascular system. The earlier blockages are detected, the higher the chances of preventing serious complications such as heart attacks or strokes. Early diagnosis opens the door to effective treatment, which may include medications to lower cholesterol, lifestyle changes, or, in more severe cases, procedures such as angioplasty or stent placement. Preventing arterial blockages is one of the most effective ways to protect your cardiovascular health and avoid serious complications. Although factors like genetic predisposition and age can't be controlled, there are several lifestyle changes that can make a significant difference in the health of your artery. The good news is that these strategies not only help prevent blockages, but also contribute to overall well-being. A balanced diet is key to keeping your arteries healthy. Some practical tips include reducing the consumption of saturated and trans fats. Avoid processed foods, fried foods, and packaged products. These types of fats contribute to plaque buildup in the arteries. Prioritizing healthy fats. Include foods rich in omega-3 fatty acids, such as salmon, sardines, walnuts, and flax seeds. These fats help reduce bad cholesterol, LDL, and increase good cholesterol, HDL. Increase fiber intake. Whole grains, fruits, vegetables, and legumes are rich in fiber, which helps lower blood cholesterol levels. Moderate salt. Excess sodium contributes to high blood pressure, which is directly linked to the development of atherosclerosis. Sedentary behavior is one of the biggest enemies of cardiovascular health. Regular physical activity improves blood circulation, helps control weight, and lowers cholesterol levels. Choose activities you enjoy. Walking, swimming, dancing, or even gardening are great options to keep your body moving. Aim to exercise for at least 150 minutes per week, spread over 30-minute sessions, 5 times a week. Chronic stress can increase blood pressure and trigger harmful behavior, such as overeating unhealthy foods or smoking. Useful strategies include relaxation techniques. Try meditation, yoga, or deep breathing. Manage your time. Avoid overloading yourself and set limits on daily tasks. Cultivate hobbies, enjoyable activities like reading, listening to music, or playing sports. Help balance your emotions. Quit smoking. Smoking is one of the biggest enemies of your arteries, contributing to plaque formation and damaging the blood vessel lining. Quitting smoking is one of the most impactful actions you can take to protect your cardiovascular health. Get regular checkups. Regular medical checkups help identify and address risk factors like high cholesterol, high blood pressure, and diabetes before they develop into more serious conditions. Important tests: cholesterol, blood sugar, blood pressure tests, and, in some cases, ultrasounds or other imaging exams should be done periodically, especially for people over 40 or with a family history of cardiovascular diseases. Control your weight. Excess weight, especially in the abdominal area, increases the risk of cardiovascular diseases. By adopting a balanced diet and exercising, you can maintain a healthy weight and reduce strain on your heart and arteries. Take care of sleep quality. Getting enough sleep is essential for body regeneration and for keeping the cardiovascular system functioning properly. Studies show that lack of sleep can raise blood pressure and increase the risk of atherosclerosis. Set a sleep schedule and avoid using electronic devices before bedtime. Implementing the prevention strategies mentioned not only reduces the risk of arterial blockages, but also transforms your overall health. With continuous healthy habits, you can notice significant improvements in physical, mental, and emotional well-being. Studies show that people who maintain a balanced diet, exercise, and avoid smoking are less likely to develop cardiovascular diseases, such as heart attacks and strokes. In addition, these changes reduce the risk of associated conditions like type 2 diabetes, hypertension, and obesity, providing comprehensive protection for the body. With the heart and arteries functioning efficiently, the body receives more oxygen and nutrient, resulting in greater energy for daily activities. This energy boost contributes to a more active and productive lifestyle, promoting overall well-being. The impact of healthy choices is directly reflected in life expectancy. Studies suggest that people who adopt preventive habits are more likely to live longer and with fewer physical or cognitive limitations in their later years. By prioritizing health, you can become an inspiration for friends, family, and colleagues, encouraging them to adopt similar behavior. This ripple effect helps create a support network and motivation for everyone around you. When arterial blockages are already present, it's crucial to act quickly to restore blood flow and avoid serious complications. Fortunately, advancements in medicine offer a variety of treatment options, ranging from lifestyle changes to advanced medical intervention. The choice of treatment depends on the degree of blockage, location, and the patient's overall health condition. Now that you've learned the importance of detecting, preventing, and treating arterial blockages, it's essential to understand that cardiovascular health should not be neglected. Every small effort, whether in your diet, stress management, or physical activity, significantly contributes to the health of your artery and your overall well-being. Don't wait for warning signs to become severe. Early detection can save lives. The good news is that by adopting healthy habits, you're not just preventing arterial issues, but also improving your overall quality of life. A balanced diet, regular exercise, and eliminating harmful habits like smoking have a direct impact on your heart's function and overall blood circulation. Additionally, continuous medical monitoring and regular checkups are crucial to ensure you're on the right track. The final message is clear. Take care of your arteries now to avoid complications later. If you're noticing any warning signs or already have risk factors, don't delay seeking a diagnosis. And if you haven't started preventive practices yet, it's never too late to begin. Schedule a checkup with your doctor, review your habit, and make healthy choices today to ensure a healthier tomorrow with fewer worries. Your cardiovascular health is in your hands.